Every single day, seniors over 60 experience symptoms that their body is sending as urgent warning signals, and every single day those signals get dismissed, explained away, or simply ignored because they do not look like what most people expect a heart attack warning to look like. Not the dramatic chest-clutching Hollywood heart attack, not the sudden collapse that everyone recognizes immediately, something far quieter, something that feels like indigestion, something that feels like unusual tiredness that you cannot shake, something that feels like a pulled muscle in your jaw or an unfamiliar pressure in your upper back or a shortness of breath climbing stairs that you walked up just fine 6 months ago. And here is what makes this so specifically important for seniors over 60 to understand, and what most people in this age group have never been clearly told. In adults over 60, and particularly in women over 60, the most common early warning signs of an impending cardiac event are frequently not the classic chest pain and left arm pain that most people have been taught to watch for. They are symptoms so different, so easily attributed to something less serious, so completely outside of what most people expect that they get dismissed every single day by the very people whose lives depend on recognizing them. Fatigue so unusual and so disproportionate to your activity level that it feels like something your body has never done before. Jaw discomfort that seems dental. Upper back pressure that seems muscular. Nausea without obvious cause. A general sense that something is simply not right that you cannot quite locate or name. I am Dr. Michael Kent, and today I am giving you all 7 of these early warning signs. What each one feels like, exactly why it happens, and why recognizing even one of them early is the difference between getting help in time and missing the window when help makes all the difference. Please watch this video completely. Share it with everyone over 60 that you love. This information saves lives. Before I walk you through all 7 warning signs, I need you to do one thing right now. Scroll down to the comments and drop your age and your city, just those 2 things. I personally read every single comment on this channel, and I want to know exactly who is watching today. Age and city, drop it right now. And please, share this video with at least one person over 60 in your life before this video ends. You may not realize it today, but that share could be the most important thing you do this week. Now, before I give you the 7 warning signs, I want to establish something critically important as the foundation for everything that follows. If you experience any symptom that concerns you, any symptom that feels unusual, persistent, or simply wrong in a way you cannot explain, the right response is always to contact your healthcare provider or seek emergency medical care. Nothing in this video is a substitute for professional medical evaluation. What this video is designed to do is give you the awareness to take those symptoms seriously rather than dismiss them, because the gap between a warning sign and a tragedy is almost always a gap in awareness rather than a gap in caring. You care about your health, you care about the people who love you. Today I am giving you the awareness that closes that gap. Now let me walk you through all 7 warning signs with enough detail about each one that you will recognize it immediately if your body sends it to you. The first warning sign is unusual fatigue. And I want to be very specific about the word unusual because this is the distinction that matters. Everyone gets tired. Fatigue from exertion, from poor sleep, from a busy day is normal and expected. The fatigue that represents a cardiac warning sign is qualitatively different from normal tiredness in a way that most people who experience it describe consistently and similarly. It is a profound, heavy, whole-body exhaustion that is disproportionate to what you have done, meaning you feel exhausted after activity levels that would not normally produce that degree of tiredness. It often comes on suddenly rather than building gradually through the day, and it has a quality that many patients describe as feeling like something is wrong rather than simply feeling like they need rest. In women over 60, this unusual fatigue is the single most commonly reported symptom in the days and weeks before a cardiac event, appearing in the majority of cases and yet being dismissed almost universally because fatigue is so common and so easily attributed to age, to stress, to poor sleep, or to dozens of other benign causes. The physiological reason this fatigue occurs is that a heart that is struggling to maintain adequate cardiac output in the setting of reduced coronary blood flow begins diverting oxygen delivery away from peripheral muscles and toward essential organs, producing the profound muscular fatigue that is the body's response to cardiac compromise. When you feel fatigue that is unusual, disproportionate, and accompanied by any sense that something is simply not right, please contact your healthcare provider that day. Do not wait to see if it passes. The second warning sign is shortness of breath with activities that previously did not cause breathlessness. This is one of the most specific and most diagnostically significant of all the warning signs I am going to describe, and it is one that seniors frequently attribute to simply getting older or being out of shape rather than recognizing it as a potential cardiac signal. The key distinction is change. If you have always been somewhat short of breath climbing a particular flight of stairs, that is your baseline. If you have recently become short of breath climbing stairs, walking a distance, or performing activities that you were managing comfortably 6 months or a year ago, that change is significant and warrants medical evaluation. The physiological mechanism is directly cardiac. When coronary artery blood flow is compromised, the heart muscle becomes less efficient at pumping blood. The lungs, receiving blood from the right side of the heart and returning oxygenated blood to the left, begin to experience a backup of pressure when the left heart's pumping efficiency decreases. And this pulmonary pressure increase produces the sensation of breathlessness even with minimal exertion. Shortness of breath that represents a new change from your previous baseline, particularly if it is accompanied by any other symptom on this list, is a reason to seek medical evaluation promptly. The third warning sign is jaw discomfort, pain, or pressure. This is perhaps the most frequently dismissed of all cardiac warning signs because the jaw is so anatomically distant from the heart that the connection seems impossible to most people who experience it. The mechanism behind jaw pain as a cardiac warning sign is referred pain, a phenomenon where pain originating from one organ is perceived in a completely different body location because the sensory nerve pathways from both locations converge at the same level of the spinal cord or brainstem. The cardiac sensory nerves and the jaw sensory nerves share overlapping pathways in the brainstem, meaning that pain signals originating from ischemic heart muscle can be perceived by the brain as coming from the jaw rather than from the chest. Cardiac jaw discomfort typically feels like an ache, a pressure, or a soreness, rather than a sharp toothache type pain. And it often cannot be reproduced by pressing on the jaw or by chewing. It may come and go. It may be more prominent during physical exertion and ease with rest. If you experience jaw discomfort that does not have an obvious dental explanation that comes and goes and that is accompanied by any other unusual symptom, please seek medical evaluation promptly rather than making a dental appointment and waiting. The fourth warning sign is upper back pressure or discomfort, particularly between the shoulder blades. Like jaw pain, upper back discomfort as a cardiac warning sign operates through the referred pain mechanism. Cardiac sensory nerve pathways sharing brainstem convergence with the sensory pathways from the upper back and interscapular region. Cardiac upper back discomfort is typically described as a pressure, a heaviness, or a squeezing sensation between the shoulder blades, rather than the sharp, localized pain of a muscle strain or the specific pain of a spine condition. It may radiate from the center of the chest into the upper back. It may appear without chest symptoms at all. And because upper back discomfort is so commonly attributed to muscle tension, poor posture, or sleeping position, particularly in a population that already has other musculoskeletal complaints, it is dismissed with remarkable consistency, even when it represents a genuine cardiac warning. The distinguishing feature to watch for is upper back discomfort that comes on with exertion and eases with rest, that appears suddenly without an obvious muscular cause, or that is accompanied by any other symptom from this list. The fifth warning sign is nausea, indigestion, or stomach discomfort without an obvious dietary cause. The vagus nerve, the primary autonomic nerve connecting the brain to the heart and digestive system, carries sensory information from both the heart and the gastrointestinal tract to the same brainstem processing centers. When the heart is experiencing ischemic stress, vagal activation produces symptoms in the gastrointestinal system: nausea, a sense of indigestion, stomach heaviness, or even vomiting, that feel entirely digestive in origin. This is why so many cardiac events in seniors over 60 are initially attributed to something eaten rather than to what is actually happening in the coronary circulation. The distinguishing feature is nausea or indigestion that appears without any dietary explanation, that comes on at rest or with exertion without relation to meals, or that is accompanied by any unusual sweating, unusual fatigue, or any other symptom from this list. Nausea that appears alongside any other cardiac warning sign should always prompt immediate medical contact rather than antacid treatment. The sixth warning sign is dizziness or lightheadedness, particularly if it is new, unexplained, or occurs with exertion. When cardiac output is compromised by reduced coronary blood flow, cerebral perfusion, the blood flow to the brain, can decrease sufficiently to produce dizziness, lightheadedness, or a feeling of near faintness. This cardiac dizziness is typically position independent, meaning it is not the dizziness of getting up too quickly from a seated position, which is a benign blood pressure regulation issue. Cardiac dizziness tends to occur during or after exertion, may be accompanied by unusual sweating or nausea, and has a quality that patients often describe as feeling faint or as if they might lose consciousness rather than the room-spinning quality of inner ear dizziness. New onset dizziness in a senior over 60, particularly with exertion, particularly if accompanied by any other symptom from this list, warrants same-day medical evaluation. The seventh warning sign is cold sweats or unusual sweating without exertion or obvious cause. When the heart is under significant ischemic stress, the sympathetic nervous system activates in a way that produces a characteristic cold, clammy sweat, different in quality from the warm sweating of exertion or heat. This cold sweat often appears on the forehead, the upper lip, or the palms, and may be accompanied by a sense of anxiety or impending doom that patients frequently describe as a feeling that something is seriously wrong even before they can identify any specific symptom. This sympathetic activation sweat is a late and significant warning sign, meaning its presence warrants immediate emergency medical contact rather than watchful waiting. If you or someone you love breaks out in a cold sweat without obvious cause, particularly alongside any other symptom from this list, please call emergency services immediately. Do not drive yourself to the hospital. Call for emergency assistance. Now I want to tell you about Cooper. He is 68 years old, a retired engineer from Georgia who came to see me for a routine follow-up appointment 14 months ago. Cooper was not in my office because he was concerned about his heart. He was there for a routine medication review, but as I went through my standard questions, something he mentioned almost in passing stopped me completely. He said, "I have been more tired than usual for the past 2 weeks. Not sick tired, just heavy tired. I cannot explain it exactly. And my jaw has been a little sore. I thought maybe I had been grinding my teeth at night." I asked him 3 more questions. Was the fatigue disproportionate to his activity level? Yes. Was the jaw soreness reproducible by pressing on his jaw or chewing? No, it was more of a background ache. Had he had any shortness of breath with his usual activities? He paused and said actually yes, climbing the stairs to his bedroom had been slightly harder than usual lately. I did not complete the medication review. I sent Cooper directly for an urgent cardiac evaluation that afternoon. The evaluation revealed significant coronary artery disease with a critical narrowing in his left anterior descending artery, one of the most dangerous coronary lesions in cardiology, sometimes called the widowmaker because of its potential consequences if it occludes completely. Cooper received intervention that afternoon. He went home 2 days later. He told me at his follow-up appointment, "Dr. Kent, I almost did not mention the tiredness. I thought it was just age." I want every person watching this video to hear Cooper's story. Not to be frightened, but to understand that the warning signs your heart sends are real, they are recognizable, and acting on them changes everything. Cooper is playing golf every weekend. He is coaching his grandson's little league team. He is here because he mentioned the tiredness. And because someone was listening carefully enough to hear what it meant, here is what I need you to remember from today's video. 7 warning signs: unusual fatigue disproportionate to activity, new shortness of breath with previously manageable activities, jaw discomfort that is not dental in character, upper back pressure between the shoulder blades, nausea or indigestion without dietary cause, new unexplained dizziness particularly with exertion, and cold sweats without obvious cause. Any one of these symptoms, particularly in combination with any other on this list, warrants prompt medical contact. Not tomorrow, not after the weekend. That day, the window between a warning and an event is real, and acting within that window is what saves lives. Right now, before this video ends, please do 2 things. First, scroll down and drop your age and your city in the comments. I read every single comment personally. Second, and this is the most important thing I will ask you to do today, share this video with at least one person over 60 that you love right now before you close this page. A parent, a spouse, a friend, a neighbor. You may not know whose life that share saves, but the statistics say it will matter to someone. I am Dr. Michael Kent. Please take care of your heart, and I will see you in the next video.